Hi there, thanks for tuning in to our volunteer presentation with protocols and overview for COVID-19. In response to the widespread of COVID-19, we are implementing a few additional policies and procedures during this time with the goal of reducing the risk of exposure. We ask that you please check your email on a regular basis, especially if you are completing mini routes with us during COVID-19. It is important just to stay updated, and I will keep you updated as much as possible. But that is the best way to remain in contact in case any issue, question, comment, or general concern arises. Here we have COVID-19 basics. We just give some general info of what is it exactly, how does it spread, symptoms typically include. Also going over that even though there is no cure or vaccine, we are still staying alert at this time and informed. We provided reliable websites below that are listed in blue and hyperlinks if you want to continue to stay updated and learn more at your own leisure. Here on this page, we have our general COVID-19 exposure recommendations. The first thing that we're asking is staying away from people, but keeping in mind when you're volunteering with our organization, what we mean by that is remaining in your vehicle, calling instead of going into our office spaces, and keeping the distance from other volunteers as well as staff. Washing your hands often with warm water and soap, and if you do not have that accessible to you, then you can use hand sanitizer as a replacement, but just ensuring that it has that 70% of alcohol in the sanitizer in order for it to be effective. Practicing and maintaining physical social distance at all times. Reiterating that when you're volunteering with us, keeping that distance not only with our staff but with our clients to make sure that we are being as safe as possible. In addition to the recommendations provided on the previous slide, we also have some others, and that is just being aware that the virus is thought to spread mainly from person to person, but also to avoid surfaces that are touched by multiple people, as well as objects. Avoiding touching your eyes, your nose, your mouth with unwashed and clean hands while in community settings. Making sure that you're wearing a mask as it pertains to delivering and volunteering in our organization, making sure that you have a mask on while delivering to our clients, as well as any interactions that you may need to have with our staff while being in your vehicle. It is still important to make sure that you still have on a mask during those times. And just as a reminder, older adults and people who have severe underlying medical conditions like heart or lung disease or diabetes seem to be having a higher risk of developing serious complications from COVID-19. The next slide provides information on how long does COVID-19 live on surfaces. A few examples could be paper, glass, stainless steel, but when you read over this, you will have a general idea of the amount of days that COVID-19 can be on a surface. Here we have our meal pickup protocol. Volunteers who have served with YMAL prior to April 1st will be eligible to continue to deliver meals at this time. Volunteers must have their own transportation during this time. In previous months, we did offer ride-alongs, but during COVID-19, We are making sure that we are continuing to practice that social distancing. So the only option right now would be having your own transportation to complete many routes. Volunteers in pairs or groups should be from the same household, living together under one roof. So then we can allow you to volunteer, but we can no longer do friends or, pairs that are coming from a variety of households at this time. All volunteers complete our daily health screening survey. This is required in order for you to volunteer with us, and we need you to complete it every day that you are signed up to complete a volunteer shift with us. Meal pickup is now set up in a curbside to go type of model. So when you pull into the Y-Mile parking lot, we ask that you remain in your car. Once your items are ready, a staff member will bring them out to you. All volunteers should wear gloves, goggles, and masks during meal delivery. We will provide gloves, but if you do have your own gloves, we encourage you to bring them as well. We ask that you please bring goggles. If you do not have goggles, it is not a mandatory requirement. We do encourage that you have goggles to refrain from touching your face in the eye area. If you have glasses that you wear daily, that also can work as well. And then we do require you to wear masks or some type of facial coverage that is covering the top of the bridge of your nose down to your chin while you are interacting with staff, other volunteers if it may be, and especially clients when delivering to them, going to their homes. Please bring your own hand sanitizer with you and use that before and after you put on gloves, and as well in between handing meals to clients. On this page here, we have additional details about how to follow the rules for curbside to go. The church will remain locked at all times, and as a reminder, we're asking you to please not enter the building. When you arrive, you can call the office, the main number at 734-487-9669, or you can call a Y-Mile staff member. We do have the key staff members listed on the last page of this presentation. Via phone, please tell the Y-Mile staff member the make of your car, the model, and the color of the vehicle. And then you can either pop open your trunk or open one of your side doors and get back in your vehicle. A staff member will come out and place those items in your car for you, and then you will be required to close either your trunk or your door. We continue to go in even more detail to make sure that we are being as safe as possible while giving you your meals and while you are out on routes. So volunteers are not to exit their vehicles while Y-Mile staff are bringing their meals or care items out to them. Please stay in your vehicle. If you have a question or concern, we can talk to you, but it will be from that 6 feet distance. You can also call us if you have a question that we can answer via phone. Once your items have been loaded into your vehicle and the employee has walked away from your vehicle, then you are able to exit your car, retrieve your items, your route sheet, and close the door, the trunk, or whatever you may have opened. Gloves will be given to you in a Ziploc bag. Please put on a new clean pair of gloves only when you have arrived at the first client's home and are outside of your vehicle prepared to retrieve the meal to give to the client. We ask you use a new clean pair of gloves for each delivery. If a new pair isn't available, use hand sanitizer to thoroughly clean your gloves between deliveries. Once gloves are on, please do not touch anything else besides the food. Volunteers are not to enter the client's homes under any circumstances. We do understand that some clients have a much harder time getting to the door, and we are working diligently with those clients to come up with a solution. But during this time, even for clients who may have a harder time or look more bedbound, we still are not allowed to go into their homes. Volunteers are to use protective gear, including goggles, gloves, and masks for every delivery. Gloves will be provided. Please bring goggles and masks. Goggles and masks must be sanitized daily. Do not touch your face, especially your eyes, your nose, or mouth, or personal belongings during delivering the meals. Keep used gloves contained in a plastic bag, preferably one that closes securely and does not get near your new or clean gloves. Keep in mind that clients are more vulnerable to COVID-19 exposure from you, the volunteer, than vice versa. These guidelines are to help reduce unintentional exposure. And then just continue to repeat these steps as you go to each home. En route delivery continue. Upon arriving in the driveway, call the client to let them know you have arrived. Get verbal confirmation that they are there before proceeding with your delivery. Put on a fresh pair of gloves or sanitize only after you are out of the vehicle and ready to deliver the meal. Once gloves are on, nothing else besides the food should be touched. Close the cooler lid with your elbow. You can close it more tightly after you've completed your delivery. Use gloved hands. Place clients' meals in a plastic grocery bag. Place food on the table, chair, or other designated surface near the door, but outside the client's home, or hang from the doorknob. Do not do this without first talking to the client on the phone. Note, if undelivered meals are in a grocery bag, they may be offered to the next client on your list after placing the meals in a fresh grocery bag if the previous one hung on the door. We continue to expand as much as possible while en route things that you need to do. Make sure that you knock loudly, and then you're stepping back at least 6 feet from the door, waiting until the client responds, giving some indication that they know their food is waiting. No meal should be left without visual confirmation, acknowledgement of the client that they have gotten their meal. No response from the client equals do not leave their meal behind. We continue to provide even more insight on how to properly deliver additional items, whether it may be from our personal care pantry, Starbucks, or extra produce in general. Please read over this to make sure that you have a full understanding of how you need to properly handle and deliver those items to our clients. On this page, we're going over what to do if the client does not answer. The bullet points will walk you through each step that we cannot skip because each step is important to make sure that we are following best practices in case a client is not home. If undelivered meals are delivered in a grocery bag, they may be offered to the next client on your list. The goal is to not bring any food back to the office. So, if you follow these steps in detail, then you're able to give those meals to another client who is willing to accept additional food. Okay, you've completed your menu route. Everything went well. Now you're coming back to the Weymouth site to drop off your items. So we have 5 key steps that you need to follow to ensure that we can complete your volunteer shift and that you can drop off everything that we need to have in order for the next day. So please make sure that you read through these, and if you have any additional follow-up questions, you can either email me or you can call me at 734-487-9669 with any additional questions. Thank you all so much for taking the time to go through our COVID-19 volunteer training. If you have at all any questions, any concerns on the volunteer process, or just in general questions for us, please email me at volunteer@ymow.org, and I can follow up with any questions or concerns you may have. I can also be reached via phone by 734-487-9669 extension 3. And then if you also want to reach me on my cell, you are free to email me and I will provide that information to you. Thanks and have a good day.